that babies should have their first dental appointment at 6 months? I'm a dental hygiene student. Let's talk about it. So by 6 months, they usually grow the mandibular central incisors, these first little two teeth. I'm not sure if you know this, but you're not supposed to let your baby go to bed with a bottle at any age, really, especially when they have teeth, because it can cause childhood cavities. So let's say you give them a bottle of milk before they go to bed because you're tired, you just want things to get over with, but you gotta make sure that you at least scrub their teeth with a moist washcloth or a really soft baby toothbrush. Although it feels unrealistic, brushing twice a day is recommended. They just need a tiny smear layer of child toothpaste, very tiny, probably smaller than a grain of rice, and a really soft baby toothbrush. And you just brush that little cervical third. If they don't have big teeth, it's right there. That's basically like a little cervical third. You just put their lower lip down and just brush. It's very important to look and see if they have any demineralization in the teeth, anything that looks chalky white. So this is kind of what demineralization looks like. This is a little bit more extreme, but just look for these white spots of demineralization. It's a lot whiter than the baby's teeth, and baby's teeth should be white and opaque, but it should not be this kind of chalky white. And that poor little papilla is so inflamed. Oh. Childhood caries should be taken very seriously because if they have cavities, because it can affect the grown-up teeth, the adult teeth, the permanent teeth. What you may not know is that the roots from the primary teeth, the baby teeth, get absorbed and made into adult teeth. Is that not crazy? So if you don't take care of this, then the cavity's gonna eat away the tooth, and then you're just gonna have bad adult teeth. So the importance of not letting your child suck on a pacifier for too long, because it can cause an open bite. And it can cause issues with swallowing and eating and just cause a lot of problems. If you use any pacifiers, it should be orthodontic pacifiers. It helps create that palate that needs to happen, because when they suck on a regular pacifier, it kind of makes a shallow palate and kind of makes their teeth spread out like I showed you. But this helps form that palate correctly. I was one of those kids who had to get weaned off of my pacifier. They would bribe me with fruit roll-ups. So make sure that your child is off of the pacifier by at least 1 year old or 2. Along with pacifiers, do not put it in your mouth. So if it falls on the floor, just don't do that, because you as the caregiver can have different germs in your mouth. So when you give it to the baby, they are at risk for now getting the bacteria that you spread to them. So be careful when it comes to spreading the bacteria. You may be the mom, but also you gotta be aware of the oral cavity. It's sterile at birth and eventually over time gets the bacteria, but if you have cavities, if you have any gum disease, it can translate into that mouth. It's also very important to create a good relationship with the dentist, because a lot of the time parents like to threaten children with the dentist, and I truly think that if you create a good relationship with the dentist, that the child will have a better idea of brushing and taking care of their teeth. If you tell a child, if you don't brush your teeth, we're gonna take you to the dentist and they're gonna drill your teeth, you think a child's gonna wanna come to the dentist? No, you're gonna scare them. So I think making it a reward is way better than creating a threat. So don't threaten your kids, because then I think that's honestly what causes dental anxiety. I don't know, I don't have dental anxiety, but also let me know what made you have dental anxiety. Give me your thoughts, I'm curious. Anyways, if you have any other questions, let me know. This is just the basic information. I didn't go through everything, but I hope this helped.